Hi everyone, my name is Konthauzam Sophia Devi, working as an assistant professor, Department of Child Health Nursing at Athena Institute of Nursing. Today, I will talk about APGAR Score. So, what is APGAR Score? It is a mnemonic of APGAR. A stands for Appearance, P stands for Pulse, G stands for Grimace, and A stands for Activity, and R stands for Respiration. It is a scoring system for the clinical assessment of the newborn baby as a part of the immediate newborn care. When do you do this APGAR score? It is done at first minute of life and at 5 minutes of life. The maximum scoring is 10. Each item should be given 0, 1 and 2. Each item should be given 0, 1 and 2 scoring. The maximum score is 10. And if the baby score 7 to 10, it is considered as normal. If the baby is scoring 4 to 6, it is considered as moderately distressed. If the baby score 0 to 3, it is considered that severely distressed. So how to check the APGAR score? As I told you earlier, each item should be giving 0, 1 and 2 scoring. So the first item is appearance, the color of the baby. If the baby body is completely pink, then we will give a scoring of 2. If the baby body is pink and the extremities are blue, then we will be giving a scoring of 1. And if the baby body is fully blue or pale, we will have a scoring of 0. The next component is P, heart rate, pulse. So we have to check the pulse of the baby. If the baby pulse rate is more than 100, then we will give a scoring of 2. If the baby pulse rate is under 100, we will give a scoring of 1. And if the pulse rate or heart rate is absent, we will give a scoring of 0. The third component is grimace, reflex. So if the baby is promptly responds to the stimulation, we will give a scoring of 2. Minimal response, we will give a scoring of 1. And if the baby is floppy or no response, we will give a scoring of 0. Okay, the fourth item is the activity, the muscle tone. If the baby is well flexed, we will give a scoring of 2. If the baby extremities is flexed, then we will give a scoring of 1. And if the muscle tone is absent, we will give a scoring of 0. The last item is respiration, the effort of respiration. If the baby is vigorously cry, we will give a scoring of 2. If the baby respiration effort is slow or irregular, we will give a scoring of the 1. And if the respiration effort is absent, then we will give a scoring of 0. I hope everyone understood about my topic. So now Athena admission is going on. So come and join at Athena. Thank you everyone.